Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Welcome. Thank you for being with me today on Perspectives on Healthcare. My guest today is Lindsay Parks. He is an osteopath who practiced family medicine in a rural setting in Western Pennsylvania. He is a member of the baby boomer generation. And Lindsay, welcome to the show.
Thank you, sir. Appreciate it. It's good to be here.
Absolutely. So let's jump right into this. Tell me about yourself and your role in healthcare.
Well, looking back over my increasingly long life, I do remember that being a doctor was the only thing I ever wanted to be. And I started working in a hospital, volunteering in a hospital when I was 15, the same hospital I was born in, and the same hospital my oldest son was born in Bryn Mawr, Pennsylvania. And from there, I just steadily went on through high school, college, and medical school, and got to be the physician by the grace of God that I always wanted to be. I don't think there was ever a time in my life where I did not want to be a doctor.
Okay. So, Lindsay, tell me, what drew you to the osteopathic route? Or maybe some people aren't familiar with what it means to be a doctor of osteopathy. What is that, and kind of what drew you there, if you don't mind?
Well, it was the school that accepted me first, and I had kind of made myself a promise that whichever of the 6 medical schools in Philadelphia accepted me first, I would go there. A DO has all the training that an MD has, and then some. We have to pass the same boards, have to pass the same licensing tests. But from day one in an osteopathic medical school, they also teach you of the value of manipulative medicine on the human spine and how it interacts with internal medical issues. So we have to learn that as well. We end up actually having considerably more training than the typical MD has.
Okay. Thanks for explaining that. What does quality healthcare mean to you?
Well, that's a great question. And quality initiatives are being studied and enforced by many of the third-party payers. They are actually rating their physicians, and physicians have to now maintain a number of items of quality, or they may not be able to stay with the organization. So they base quality mostly on outcomes, but along the way towards outcomes, there are many, many things that have to be checked, many boxes that have to be checked to make sure that each patient for each diagnosis is being given the very best medical care, that nothing is being missed, and that all bases are being covered. So quality has taken on a really bigger new meaning over the last 10 or 15 years.
Okay, I'm curious to get your opinion on this. If quality is based on outcomes, sometimes it's not going to be a good outcome. If somebody is diagnosed with a terminal illness, the outcome is obviously going to be their passing. What's your opinion on how to judge the quality of healthcare that the person is receiving, that when when sometimes the outcomes aren't good, or that, sometimes, for example, for someone like me who acquired a disability, that's not the desired outcome. You would like to be able to walk and to do all those kind of things. How do you judge quality healthcare when it comes to, not the most desirable of outcomes?
That's a great question. Going into the care of a patient, there are realistic expectations that should be set between the physician and the patient. And I viewed it that it was always a team approach, that I could never force anything on a patient if they did not want it. Certainly in a terminal illness, there still are quality of care issues. You want to make sure that the patient is being cared for socially and emotionally and spiritually, as well as physically. And in a terminal care case, you want to make sure they get the best care heading into the terminality, because every once in a while, you have the great joy of seeing it turned around. But specifically for someone who is terminally ill, you want to make sure that their last days here are days without pain and suffering, and to maintain their dignity. So there are a lot of things that go into that.
Excellent. Can you give me an example of quality healthcare?
Well, from my perspective as a physician, there were demands that I placed upon myself, because quality healthcare, I feel, generally starts with the practitioner. One of the things that was very difficult, they used to say that a family doctor knows less and less about more and more, because we have to cover almost everything from pediatrics to geriatrics and everything in between. I found out fairly quickly in my practice, and when I retired in this past December, I had been 43 and a half years in the same office, which is kind of unusual today. But you have to stay current. And I realized as the years went by that I was making diagnoses and treating illnesses that I never had learned about in medical school. And it's amazing how many new conditions are being discovered and needing to be treated. So you have to stay current. Quality healthcare, as far as an individual physician, you must be honest. You must be honest with the patient. You must also show them that you care. It is very important for a physician to be friendly and to befriend the patient. There's no place in medicine for arrogance. And I know that you and I have both known and probably been treated by physicians who seem to have an I'm better than you attitude. And that does not fly in a physician-patient relationship. It just simply does not.
Yeah, there's an old joke about the difference between God and doctors is that God doesn't think he's a doctor, but I understand where you're coming from, and that sadly, yes, I have had that experience. What do you wish people understood about your role in healthcare, whether that's the osteopathic side of it or the family doctor practice? What do you wish folks understood about your role?
Well, a physician really needs to understand the fact that it's a life, not a job.
How do you mean that?
Well, you can get done your day at the office and come home to your family and then still be on call and be called back into the hospital several times at night, and then have to get up the next morning and go back for another day. It is something that is very demanding. It's hard to get away from. And, physicians just long for their time that is theirs, where the beeper is off and the phone is off and the like. I always felt that patients needed to respect that too, but with a smile on my face, I can't tell you how many times with my family walking through the mall or walking through town, I would have somebody stop me on the sidewalk and begin to tell me about their latest complaint and ask me, what they should do about it. So doctors live a life. It's not just a job, but we do look forward to the moments that we can spend our life in private.
Yeah, I would imagine it's got to be like a fine line, because as someone who has health concerns, when I'm having those, they become first and foremost in my mind. And so I see you as a doctor. I'm like, oh, hey, there's my doctor. I need to ask a question. I've got this thing that's been bothering me. And yet there is the need to have that balance. A very, very valid point. What excites you about the future of healthcare?
Well, I'm impressed by the quality of the new physicians that are being accepted into medical school. Medical schools used to admit students based on their grade point average, no matter what their undergraduate was. But they are getting smarter now. They are screening their students. They are looking for students that are very well-rounded, but have had a significant interest in medicine. They are accepting them based on what they perceive to be their potential as a good, well-rounded physician. It's also exciting to see the technological advances that are coming. It's almost exponential how they are coming so rapidly. One of my philosophies as a physician was to never give up on a diagnosis and to always listen to the patient. I was taught in medical school that if you listen to the patient long enough, they will tell you what's wrong with them. And that very often is true. Doctors are sometimes way more prone to talk and way less prone to listen. But with the new technology that's coming, every month there's something new. Along with that is how quickly new treatments are being found for new diagnoses. I mean, one of which would be how quickly they have been able to come up with effective vaccines for the SARS-CoV virus. I mean, this was a worldwide pandemic that literally put a stranglehold on the world, way over 4 million dead in a little over a year. And it's been amazing that they have come up with these vaccines so quickly. They cut a lot of the legal red tape, and they actually asked for human volunteers and got many of them, and found that some of these are not only effective for COVID, but they're effective for the new variants that are coming. Another example is the biological drugs that are being used to treat cancer and connective tissue diseases by stimulating the immune system. Very exciting medications on the horizon.
Yeah. So it's interesting that to go back to what you said about if you listen to your patient long enough, they will tell you what's wrong. The second part of that is something that I had an older doctor teach me, and that is if you listen a little bit longer than that, they may even tell you how to fix or treat what's going on with them. So very interesting. And I think you've led us into the final question, which is, what is one thing medical professionals can start doing today to improve the quality of healthcare?
Well, I think the individual responsibility of each doctor to be honest, to not be arrogant, to be friendly, to give the patient enough time, and to not rush them through things. Doctors live a very rushed life. They have to meet up with time constraints, with quotas. They have to see so many patients a year. They need to give the patient the time and the interest that each one of them deserves. And I'll give you an example of this. Doctors are being trained now to limit the complaints to 1 or 2 a visit. And if you've got more, come back and see me. Now, I can understand the rationale behind that, but I had a patient that I saw several times a year for his diabetes. He'd had type 1 diabetes for years and had been on insulin as long as he could remember. And we had a really good visit, and everything was going along normally. And I closed the chart and got up and put my hand on the door and was ready to escort him out to the desk. And he says, "Doc, there is one more question that I need to ask you while I'm here." He said, "Lately I've been waking up in the morning with my tongue and my lips all bloody." Well, I closed the door and I opened up the chart and I sat back down and we spent another half hour. It threw the rest of my day into chaos, but he was experiencing nocturnal seizures. And in the middle of the night, he was chewing his lips and his gums and his tongue. So there were two ways I could have handled that. I could have said, well, let's get you back here in a week or so and we'll talk about that. A patient really needs to have their complaints listened to, and the sooner the better. So I think quality healthcare begins with individual doctors. I think it's critical that they learn to be honest, not arrogant. They learn to be friendly, and they give the patient enough time.
Fantastic. Lindsay Parks, thank you so much for joining me today and giving us your perspective on healthcare.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.